And so I'm really excited to be able to bring our next speaker who has dedicated so much of her work to this global effort to be able to create change. I have known Anita Raj's work well before I met Anita Raj. And many of us who are fans of her research, and there are many of us who are, have really appreciated the over 100 articles that she has written and co-authored with some great colleagues to be able to bring together research with how we are going to be able to make a difference. And Anita as a researcher to me is very special because her purpose is not about just trying to get published, but it's about how is it going to have an impact in the field and make a difference. And so when we were talking in this, and I was going through, oh, I love this article and I love that article, and she was just thrilled saying, that's who I wanted to read the articles. I wasn't doing it just for other researchers. It's about having a way that we can connect and to be able to do this work. So Anita Raj is the director of the University of California, San Diego's Center on Gender Equity and Health. And for over 20 years, she's been doing exciting work, working with community-based organizations, working for immigrant rights and against gender-based violence, and to be able to look around health vulnerabilities. And that her work is around adolescents, girls, early marriage and reproductive and maternal health, HIV prevention, intervention, sexual violence and intimate partner violence prevention programs, immigrant and refugee health. She's doing work in South Asia, the United States, and in Russia. And so to me, as someone who does work in public health and brings together the science of public health and the art and passion of the movement to be able to end violence against women, Anita gives us an example of how we can be able to do this and use those tools. So I'm really pleased and excited to have Anita Raj joining us today.
Good morning. I have a very tough act to follow, so I will try to do my best. Thank you so much for inviting me. I am a professor and a researcher, and I am used to PowerPoint slides, but I am foregoing those, and I'm going to talk to you today about the issue of the pandemic of sexual violence. What is a pandemic? A pandemic means that we have epidemic proportions of violence that is occurring across nations. How pervasive is gender-based violence, and actually specifically sexual violence around the world? Well, we know that about 1 in 10 women report that they've had the history of having been sexually assaulted in the course of their marriage. About 1 in 14 tell us that they have had an experience of non-partner related sexual violence. If we think that this is the tip of the iceberg, and we do, and we assume 10% of 15 to 69-year-old adolescent girls and adult women have experienced sexual violence, we are talking about 250 million women around the world. Take a moment and digest that. That is larger numbers than we see in HIV rates. It is larger than what we see in suicide, maternal mortality, all of which get more global attention. And here's the other issue. Not only is it more pervasive, it increases risk for all of those health concerns. So we have a situation of a sexual violence pandemic. And you all are here to come together to talk about what can be done nationally. What I'd like to share with you is some of the stories we're hearing in the field about what's happening internationally around 3 issues that I really think need to get more attention and where we're starting to see progress, but more change is needed. The first is the issue of girl-child marriage, the marriage of girls prior to the age of 18, often occurring in a context of force or coercion, often without the girl's explicit choice or consent, and increasing their risk for a variety of health concerns, including forced first sex, increasing their risk for actually having sexual violence in the course of their marriage, increasing their risk for not only a lack of sexual control in their marriage, but a lack of reproductive control, which results in adolescent pregnancies, compromising maternal and child health on an epidemic scale again, pandemic scale. So I'm going to start by talking about that, and then I'm going to talk a little bit about 2 other forms of sexual violence I think we also need to have more attention around, and that's sexual exploitation and trafficking, and the issue of broad sexual safety in society. I chose these issues for the main reason that I want to think about how we are supporting adolescent girls. When I look at the rates of sexual violence globally, comparable to, in some ways, to what we can see in the U.S., we know that adolescent girls are disproportionately affected. And we believe that those effects are most commonly, or actually the data tells us that they most commonly occur in marriage, that it can compromise their safety from sexual exploitation, and that there's broader issues of sexual safety in their environment. So these are the focus points I'm going to have for today's talk. So let's start with sexual violence that occurs in the context of early marriage of girls. Early marriage of girls affects about 700 million women and girls globally. And I'll start with a story of a young woman that we met from one of our projects that it came from Bangladesh, or is in Bangladesh. Her name is Appu. She, at the age of 14, married a man. And this was with her, she doesn't indicate any opposition to the marriage, but when she married, her entry into that marriage, the night of her wedding, she experienced her first sexual experience after having been given drugs. She was told that the medication would relax her. She doesn't remember the first sexual experience, and she talked about the pain that she felt the next day. But she described the situation as one of kindness, because it allowed her to hurt less in the context. This is in Bangladesh, where about 70% of women married before the age of 18, and about 1 in 4 women report that their first sexual experience is forced, and that most of these cases are in the context of marriage. So Appu had a situation where at 14 she was married. By the age of 19, she had experienced 4 pregnancies. The last pregnancy resulted in a miscarriage and pelvic pain that required her to be taken to the doctor. It doesn't always get to be that you would get to go to the doctor, but she had a family where that was possible. With the care that she was provided, she was given a hysterectomy by the age of 19. She went through menopausal symptoms that the family didn't understand and she didn't understand. She was no longer able to have children, which was clarified, and she was abandoned by the family. This is a situation that is all too common. And I want to really emphasize this. It happens because of a normalcy of marital rape, and particularly in the context of adolescent marriages. The entry into marriage as an adolescent often happens with a greater differential between the spouse's ages, and it can compromise her ability of controlling the situation or feeling a sense of sexual knowledge or even having access to sexual information. This is an incredibly important story, and it may not be so dissimilar from what you would hear for the adolescent girls that you serve. Next, I want to talk about sexual exploitation. We know that about 4.5 to 5.5 million women and girls around the world are trafficked. And trafficking, by definition, if there's girls involved in sex trade who are under the age of 18, that is viewed as trafficking. So in addition to some of the work we do in South Asia, such as Bangladesh, we also do some work in Mexico and Central America. I'd like to share with you a story of a woman that we met in Tijuana. And let's call her Flor. I'm obviously not using real names. So Flor described a situation. She was about 20 when we met her. She described a situation where she came from a village, and at the age of 16, a man came into the village and met her family and said, "Well, I'd like to marry you. We will go, we will move to the city, it will be a better life for you." And the parents were very supportive. She was very excited about the opportunity, and she moved to the border area, Tijuana, not far from where we are located in San Diego. And she had an experience where she was then left in a facility with a group of men who proceeded to drug and commit acts of violence on her. And she was then forced into sex trade. And the guy, she never saw again. There was no marriage registry. There was no indication of what his real name was. With faith, she went, and she was left in this situation. By the age of 20, she found out she was HIV positive. A recent study that we have that came out of the same region shows us that about 1 in 4 of the sex workers that we've interfaced with in Tijuana was entered into sex work prior to the age of 18. about 1 in 8 prior to the age of 15. We know that this $32 billion industry of trafficking disproportionately affects adolescents and young adult females. And it is a leading cause or it's been highly correlated with HIV, but also a number of other reproductive health concerns. So where is our progress on this, right? We are inspired by progress, united in purpose, correct? On a global scale, I think it is actually happening. These stories are sad, but I want to highlight, we heard these stories. Why did we hear these stories? Because we met these women. Because these women had voice, and they gave that voice agency, and they met us because they were connected to organizations such as yours that are actually able to make a difference. I'm sure that there are days where you want to walk away because you cannot see one more woman that you can't support in that situation. A woman can die, she can go back to a batterer. So many times we can feel disheartened by a lack of progress. But I'm here to tell you that we meet those women and we hear those voices and we take them into our research and we use that research to support advocacy for change because of organizations like yours. They couldn't do it without your advocacy. And what does that advocacy mean on a global scale? Well, I have news for you. In Bangladesh, in India, where I also work, where we have some of the highest rates of girl-child marriage, these rates of marital rape that disproportionately affect these adolescent lives are not legally recognized. We don't have laws against marital rape in many of the countries where child marriage occurs. Well, I'm not that old, and I know that when I was in college and we were starting to look at these issues, we didn't have marital rape for all 50 states in this country. We do today. Yeah, we should. The opportunity to participate in a global process to share what we have learned in the U.S. about advocating for those kind of legal changes is vitally important. When we saw the rape case in India, that many of you know, the fatal rape case, there was so much movement to create legal change, and we worked so hard to try to get a marital rape law on the books, and we could not get it. But with united purpose, these are things we can do. With regard to trafficking, our own state has it as a priority issue. And we are actually engaged in programs that are related to economic empowerment, education, and livelihood support for the women and girls who marry as minors and want opportunities to have greater autonomy in their lives, whether in marriage or outside, as well as education and economic empowerment for those who have been sexually exploited and want alternate incomes. Change is happening. It's happening domestically, it's happening globally, and we need to be working together to learn from each other. The last issue I want to talk about is the issue of sexual safety. So I'm going to tell you a story. So sexual safety is the notion that we can walk, that we as women and girls can walk freely in society, mobile without a fear of sexual violence, sexual harassment, sexual exploitation. Yeah. So it's not a small thing, and that is related to sexual violence. I'm going to tell you another story. I'm going to tell you a story about a 14-year-old girl. You've heard about Bangladesh, you've heard about Mexico. This is a story about a 14-year-old girl who, at the age of 14, she had parents that were working outside the home. These parents, she said, I'd like to walk from the school to the library. My friends are going. They said, fine. She started doing this. There was a day where she needed to walk alone. She walked from the school to the library. It was about half a mile. The first day she walked alone, a group of boys sexually harassed her. Then and there, she decided, I'm not going to be able to walk alone. I'll get my little brother, who's inches smaller, to go with me. On that day, she learned she didn't have the freedom just to walk from the school to the library. And if she wanted protection, a boy was a better protection than she would be able to have being able to just be out there in that world. That story is from La Jolla, California. And that girl was my daughter. And I'm going to tell, and thank you, like, for all the women, but also my daughter. I want to thank them for letting me share this story, but it's my story too, because I want to tell you, as someone who's been working in this field for 20 years, what I thought. In that moment, I thought, oh, already? I guess she is in high school now, and I guess that's going to happen. Where was my outrage? Where was my outrage? Why did I believe that there was nothing that was going to be different for her than it was for me? If you have not had an experience, if you identify as a woman or a girl, and you have not had the experience of sexual harassment, I'm shocked. I don't know how many times it's happened to me. I watched her do this, and I thought, oh, of course. When you look around the world, you see similar findings. Schoolgirls in Pakistan, 96% say they've been harassed, sexually harassed. If you look in Yemen, 72%. In Cairo, it's 80%. You can see studies upon studies, and the notion that we have the right as women and girls to walk freely is compromised every time we go out, and it is reinforced by the rape that we fear. And this is where my concern is. I can see the policies. I can see the UN developments to fight child marriage. I can see the legislation, and my district attorney at home and my state attorney general and the TIP office fighting sex trafficking. But what are we doing? Where is the work to end the sexual harassment on the streets that we face every day? And where do we, why do we not draw the line between that and the sexual violence, the rape we're having on campuses, the rape we're having in our homes as married women, the rape we're having as exploited girls who have been trafficked? There is a continuum of sexual violence. When I came into this field 20 years ago, they said to me, sexual violence is not about sex, it's about violence. Hell no, it is about sex. That's how people perceive sexuality and flirting. And until we change that, we haven't addressed sexual violence. So when I hear people say, end sexual violence in one generation, I say yes. Let us end the campus assaults. Let us end the rapes in the homes, but let us not forget the marital rape of girls around the world who are being forced to marry as minors or entering into their first sexual experience in a context of coercion. Let us not forget that those girls that are exploited and trafficked due to the vulnerabilities at home need to be part of our mission around ending sexual violence. And let me say right now, I don't want my girl to go back in the street, and I suspect none of you want to either have it to yourselves or to others. We need to end street sexual harassment now. We need to recognize it's sexual violence. We need to recognize that it supports the rapes that we see around the world, and we need to make a change. So I see progress. And I see the desire for social change, and I'm inspired. What I think the next time is up is what it said, sorry. What I think the next effort at progress is not only do we have this situation to hold hands in the room across 50 states, inclusive of 7 countries, but oh my God, we've got to be working globally together. We are having the same fights in every country. The time for change is here, but it's also overseas. It's in every country in the world. And we need to be definitely engaging men and boys. And we need to definitely be utilizing the criminal justice system. And we definitely need to be supporting advocacy. But I just want to echo the statements of other people today when they say, if we do not engage in social change right now to stop the acceptability of sexualizing our girls and violating them with impunity on a global scale, we have not met the needs of this cause. Thank you.